Okay, Chapter 1, Introduction to our EMS service, Emergency Medical Services. We're going to talk about some components of the EMS system, what's your roles, what's your responsibilities as an EMT, and then we're going to touch on public health and some other specialized issues. So how we began, how did this whole thing start? In the 1700s, we basically had to come up with getting soldiers off of the battlefield into units so they could be cared for. It went on through the Civil War period, started establishing the Red Cross. As we saw the World War I, Korea, Vietnam, they started to have what's called MASH units. Just basically emergency departments in the field. So non-military, we started operating in the 1900s. We didn't have very sophisticated systems. Often it was ran by either your fire department or the funeral home would have their hearses used for dual roles. And there definitely was a need for some organization, so people were, had a little more sophisticated rules and regs. Today, the DOT is charged with developing that, believe it or not. 1970, NREMT was founded. And then we had, in 1973, NEMSA, or the National Emergency Medical Service Systems Act, was passed by Congress. And that's how we pretty much get our guidelines and our rules and regulations today. So standards, we have laws, all right. Each state varies a little bit different in what their different levels of emergency care can do. There is an EMS agency in each state, and they are funded. And they do coordinate, all right, so resource management, how we run treatment, transporting resources, what PSA is what it's called, all right, so primary service areas, who gets to cover what area, whose responsibility, what ambulance service does that, and so forth. Human resources and training, we have to be trained at minimum certified standards, so everybody's kind of streamlined. So first responders are going to get a level of training, EMTs are going to expected to have a level of training, and so forth. And then ultimately to provide safe, reliable transportation. So ambulances, you do have to be certified in ambulance operation. You can't just go ahead and jump in and drive. You do have to have a certificate for that, and those standards are set by the state. So facilities-wise, we have rules governing that. So for the most part, unless the patient requests a specific location, we're always going to transport to the closest facility, closest appropriate facility. So if we've got a major trauma, we're probably not going to go to a small town clinic for that. We're going to go to the closest trauma center that can handle that patient. Communications, they established the Universal 911. They developed dispatch to ambulance communication, ambulance to ambulance, so I can talk to, if I need a second ambulance, I can talk to that crew. Ambulance to hospital, hospital to hospital, so it's a pretty large system-wide emergency communication system. Our role also educating our public about what EMS professionals do, how to access us, and then injury prevention is a big component of what we do. So bicycle safety weeks, car seat check weeks, things like that, EMS is involved quite often in. Ultimately, the medical direction, we do have a medical director. Everyone is under a medical director, all ambulance services are. We are riding on his license. He is ultimately accountable for us within his system. So if things go wrong, ultimately it's his responsibility to look into that and to correct it. Trauma systems, we have start triage. We have what to do when the big one hits, 9/11, the Boston Marathon bombing, things like that. We do have triage transport treatment protocol, how to handle large events, large scale events like that. And then we do have quality improvement, quality education, reviewing how things are done, reviewing different cases, and ultimately that's how we get to become better providers. So components of the EMS system itself. Well, we know we have dispatch. Dispatch is going to activate EMS response. They're going to take that initial 911 call. We have our EMS first responders and EMTs and medics and advanced EMTs. We have emergency department hospital, our doctors, our nurses, and other health personnel involved. We have specialized care facilities, so specialized burn centers, specialized level 1, 2, 3, 4 trauma centers. We have children's hospitals. We have cardiac centers. So your patient, you might be diverted to a specialized care center depending on the condition of your patient. So accessing, this picture's in your book, you know that you're going to call 911, you're going to get a dispatcher. The dispatcher is going to talk to the caller as well as decide what emergency agencies need to be dispatched to that call. Then we are going to respond, of course. We're going to get them to definitive care, which is ultimately the emergency department. And then they're going to have allied health staff, which is your rehab, follow-up care personnel. So 911 is available in most capabilities. Enhanced 911 is able to ping basically the address for the caller. With cell phones, this does not work. It's getting better, but it's harder because they're pinging off of towers, and that's a large area. But if they still have a landline in their home, the 911 dispatcher usually can ping the address right off of that call. So dispatchers, they can provide basic emergency care instruction until we arrive. Early access, early prompt initiation of emergency care of CPR, starting that prior to EMS personnel's arrival is pretty important. It's going to take us 10, 15, 20 minutes to get there. By that time, that person would not be viable. So we rely heavily on our dispatchers to start and initiate that care, even if it's over the phone, giving instructions. So there they are, lots of screens to watch, weather screens, where ambulances are, if the helicopter can fly. So critical decision making is absolutely vital for this profession. We need to be able to gather information from scene. We need to assess the patient, figure out if we need additional resources, and we need to interpret all that information to decide what treatment and what transport options we have for this patient. So we need to know our base information well, and then we need to apply that information in different scenarios. So if we don't have enough information, we got to ask more questions. Otherwise, we need to perform additional physical examinations, vital signs, things like that, that maybe will help us get a clue as to what's going on with these patients. So examples of critical decisions. Should you take this patient to the closest hospital, or should we go to a specialty hospital? Okay, a burn patient, would it be better to stop at the closest hospital? Would it be better to contact a helicopter and get them to the burn facility? These are going to be decisions you'll be making out in the field. Simple medications. EMTs do give out some medications, are authorized to do that. Will it make my patient better? Will it make my patient worse? Will it not work in certain circumstances? So your levels of training, certification, the first level is emergency medical responder or first responder. Emergency medical technician would be that next level, and that's where you guys are all fit in right there. Some states do have advanced emergency medical technicians as well. It's an EMT that has some other variances that they are able to perform. Wisconsin is a state that has that. Minnesota does not. So it just depends on what state you're in as to whether that license is valid as at that level or not. And then the highest level of pre-emergency care is the paramedic. So your roles and responsibility, your safety always, always comes first, okay? Then the safety of your crew members, your patient, and your bystanders is going to follow. You need to make sure that you communicate well. You'll be working with lots of other public safety professionals in the field. You need to be able to do proper assessment and proper care. You need to make sure that you are correctly lifting, moving patients, making sure that you stay physically fit. Patients aren't getting lighter, so that plays a big role in it. Transport decisions, transfer of care. So when are we transferring the care of our patient to the next level of care or to the hospital? And then you need to be a patient advocate, right? You need to stick up for your patients. If you see something in a nursing home that isn't quite right, that looks like the patient's being neglected, it is your responsibility to speak up and right that wrong. So whether it's talking to your crew supervisor or making sure the emergency department knows it, make sure that you're doing that gold standard follow-up care for your patients. So as I said, you should be able to lift and carry patients up to 125 pounds. Good eyesight helps to see, right? Awareness with any color visions and any accommodations we need to take for that. You need to have very good communication skills orally as well as written, okay? If you have a sloppy written report, it's gonna make you look like a sloppy EMT even if you provided the best care. Being pleasant, professional, sincere, cooperative, being very resourceful. Things aren't always gonna be textbook perfect when you go out into the field. Making sure you have an open mind, making sure you're thinking of all your options. Professional appearance, we want to look the part, we want to play the part, we want to be the part. So make sure that you're looking well-groomed. Self-starter for sure. You're not always gonna have somebody standing right next to you to help you out. So you gotta make sure that you can make decisions on your own. Emotionally stable. We see a lot of traumatic things. We see a lot of very sick people. So we need to take that all into account and our emotional well-being and making sure that that profession is going to fit okay into our level. You need to be able to lead. You're going to go on to some calls that you need to take charge of what's going on, and you need to and delegate and use authority. You need to make sure that morally you're good character. We've got to really watch, especially where I work as a medic. We got to be careful what we're posting on Facebook, even if that's on our personal time. It still reflects the profession. It still reflects you as a person. So we need to be respectful. We need to be careful of that. Keeping your personal habits in check, trying to stay controlled in conversation. So somebody that's yelling and screaming at you, as much as that is hard to tolerate, we do need to take the upper hand and be professional and handle situations like that. We need to be able to listen, not just hear, listen to patients, to other providers. And we need to try to be non-judgmental and fair. It's not our place to decide right from wrong. We have patients to treat. We're going to do so accordingly. If we have a concern regarding abuse, neglect, anything like that, you absolutely can voice that, but it is not our place to take measures directly with or confront the person that could possibly be the cause of that. Education-wise, this is not going to be your first step in EMS. This is your last step, excuse me, in EMS. You are going to always have continuing education required. You are always going to be required to refresh conferences, seminars, lectures. You have minimum education requirements in order to keep your licensure. So education is going to be a forever ongoing thing in this field. Looking up new procedures, new equipment, trends, things that are coming up on the horizon. All of those things is everyone's responsibility in this field. Things evolve and change in the medical field quickly, so we need to stay on top of that. So where can you become a provider? Well, of course, an ambulance is probably your natural selection, but fire departments, we've got wilderness, wildlife, wilderness, rural teams. city settings, small town settings. A lot of the smaller rural areas have volunteer EMT departments. You can go into career fire, career ambulance. The opportunities are endless. We have people that get licensure as an EMT and using that as kind of a benefit on their resume to forward their medical careers. We have a lot of PA students. We have a lot of pre-med students that come through our programs. So the National Registry of Emergency Medical Technicians, this little patch right here is what you are striving for. So first responders, EMTs, AEMTs, paramedics have to be nationally certified. The National Registry was made to kind of make an all-inclusive nationwide certification where everybody has a base training and very similar. From that, then you're going to apply to your respective states for licensure. So you're going to get certified from the National Registry of Emergency Medical Technicians, and then you're going to get licensed per state. Quality improvement, self-review, you know, we do a lot of this kind of stuff. We do it on the way back from calls. We do it at monthly education and monthly trainings. Kind of just, it's not to point fingers at anybody, it's just to kind of look at what went well, what did we struggle with, what could we have done better, just to kind of make us all better providers. Everyone has a role. Double checking your partner's run report, your narratives is a great tool. Feedback from patients, making sure equipment's maintained, making sure your education and your licensures are all up to date. So medical direction, all of our patient care is performed under the direction of your medical director. He is ultimately responsible for that patient care. He oversees our training requirements. He develops our protocols, which is protocols are our rules. So when I run with Mayo, we do have guidelines and I need to follow those guidelines with different scenarios with patients. So it's going to give me, you should, and give me steps. And if that doesn't work, then try this. He issues offline, which means I don't have to call on the phone. So remember, online is on the phone or radio. You have to call. Offline, it's just a standing order, okay? So it means that I can look up in my guidelines. If someone's having chest pain, I am to give them aspirin, nitroglycerin, establish an IV, put a monitor on them, things like that. I don't have to call the doctor for. Online is when I need to call in, and I'm going to be talking online to a medical director, medical ED physician, and asking for their advice as to how I should proceed. So our role in public health, well, injury prevention, big one, right? For youth and for geriatrics, those are our two vulnerable populations. Assisting in public vaccination programs, watching for disease surveillance. Now, we're not the public health department, okay? But if we see a trend with similar signs and symptoms, like we go to the nursing home and we're bringing flu-like illness patients quite often, we should probably notify the public health department that there could be a possible outbreak, and then they can follow up. So we're frontline. This, you know, with COVID-19, we're all frontline. If we're seeing an outbreak of some sort with similar symptoms, we probably should be reporting to that to the public health department. So I'm just going to touch on research a little bit. Basically, you know, we're trying to improve patient outcomes. This is how we get stuff, okay? This is how we get EpiPens to treat anaphylaxis. This is how we get tools, Lucas devices for CPR, forming a hypothesis, looking at literature, evaluating, and then presenting. And if the evidence supports it, the procedure will get adopted. So not all research is created equal. There are, you know, we're going to rely on best practices, looking at observations and hypotheses. So medical research, peer review research in journals, tons of articles in EMS magazines. It's not original research, it's not peer reviewed, but it's some great information from in the field people usually. EMS1.com is great. They've got a lot of reviews, review articles on different things. I like to kind of look at that site quite routinely. So special issues, here we go. So your patient's hesitant to go to the hospital because she's worried about her dog. What can you do to assist in this situation? And what part of your role as an EMT is this an example of? And with that, I'm going to leave you on that thought to think through that. And this ends chapter 1.